the last several years, mold in residential housing has shifted from being viewed mainly as a maintenance issue to being recognized as a major housing and public health concern. And in the UK particularly, the legal expectations around damp and mold management have changed significantly. The important point to understand from the beginning is this: there is no single mold law in the UK. Instead, responsibilities come from several overlapping areas: housing legislation, health and safety obligation, landlord repair duties, environmental health concerns, and fitness standards for residential occupation. At the centre of the discussion is the principle that residential properties must be safe for occupation. That sounds simple, but legally it carries significant implications. One of the most important frameworks is the Housing, Health and Safety Rating System, commonly referred to as HHSRS. Under this system, damp and mold control are recognized housing standards. Local authorities can assess whether conditions within a property create a risk to health and well-being. And importantly, the assessment is based on health risk, not simply on visible appearance. Environmental health officers may consider the extent of the mold control, severity of the dampness, vulnerability of the occupants, ventilation conditions, heating, and likelihood of adverse health outcomes. If conditions are considered sufficiently serious, local authorities can take enforcement actions against landlords, and that may include improvement notices, hazard awareness notices, emergency remedial actions, and in serious situations, prosecution. Another major development was the Homes Act 2018. This legislation strengthens the ability of tenants to take direct legal actions where rented properties are considered unfit for habitation. Damp and mold can form part of the assessment. What changed significantly with this legislation was that tenants no longer had to rely entirely on local authority enforcement. They gained stronger direct legal routes through the courts. Now the issue that fundamentally changed national awareness was the death of R.B. Sack, following the coroner's finding linking prolonged mold exposure within housing to a fatal respiratory condition. There was substantial scrutiny of how housing providers manage damp and mold complaints, and that led to what is commonly referred to as Allow's law. Allow's law introduces stricter expectations on social landlords regarding the investigation and remediation of hazard, including damp and mold. The overall direction is clear. Housing providers are expected to respond faster, investigate the property, and avoid dismissing mold complaints as purely lifestyle issues. The last point is particularly important. Historically, some occupants reporting mold problems were told simply open windows, reduce moisture generation, or clean surfaces more frequently. Now, while occupant behavior can absolutely contribute to indoor humidity levels, current guidance makes it very clear that landlord and housing providers must properly investigate the building itself. That means considering insulation performance, heating provisions, ventilation adequacy, thermal bridging, water ingress, and overall building conditions. The professional expectation today is far more evidence-based and building-focused than it was historically. Another legal area relevant to mold cases is landlord repair obligations under the Landlord and Tenant Act. Landlords are generally responsible for maintaining the structure, the exterior elements, plumbing, heating, and certain repair-related functions. If defects in those areas contribute to dampness or mold growth, responsibility may extend beyond superficial cleaning. There is also increased overlap between mold disputes and this repair obligations. This means that surveyors, environmental consultants, industrial hygienists, and indoor air quality professionals are becoming more involved in evidence gathering and technical assessment. And that creates another important issue. Not every mold issue represents serious housing disrepair, but equally, not every mold issue is simply condensation caused by lifestyle. The reality is often more complex. A competent assessment should consider building construction, occupancy, moisture generation, ventilation, maintenance history, and environmental conditions together. One area where problems often arise is oversimplified reportings. Statements such the tenant caused mold or property is toxic are usually not professionally robust conclusions on their own. The evidence needs to support the conclusions. Current UK guidance increasingly encourages proportionate investigation, early intervention, accurate diagnosis, and timely remediations. And from a public health perspective, this approach does make sense. Another important point is documentation. Housing providers are now expected to respond to complaints properly, maintain records, and investigate concerns systematically and demonstrate reasonable actions. This is especially important where vulnerable occupants are involved. Ultimately, the legal direction in the UK is becoming increasingly clearer. They are recognized as issues capable of affecting health, well-being, and housing sustainability. But professionally, we still need balanced interpretation. The goal should not be alarmist. The goal should be evidence-based assessment, reasonable investigation, proper building management, and proportionate corrective actions. That is the direction current legislation, housing guidance, and public health policy are all moving towards.